Goodwin, Director of Marketing Communications for our network of schools, joined by Joseph Fauver, who is an epidemiologist from the Yale School of Public Health. He also happens to be Eleanor's dad. Eleanor is a 14-month-old who's enrolled in our Building Block Center in Hamden, Connecticut. And Lindsay Hoffman, who is the president of Building Blocks, our president in Connecticut. I'm going to hand it over to Lindsay in just a second. In case you are just joining us, I just want to let you know how things are going to go. Don't worry, your mic and your video are disabled, not because we don't want to see your beautiful face or hear your lovely voice. It's just so there doesn't create more lag during this presentation. Joseph is open to still answering all of your questions during the presentation if you just use the chat button at the bottom of your screen. I want to specifically say thank you so much to all of our directors from across New England who have come here with their questions on behalf of their teams and their schools to learn more about this important topic. So great to have you here. And thank you so much for registering in advance. And just want to let you know that Joseph did receive your questions before we started tonight. So with that, let you know I'll be monitoring questions and make sure we get to them. I'm going to hand it over to Lindsay to kick off the actual discussion.
Thank you, Amanda, and welcome everyone. Thank you for taking time out of your busy days and your schedule to join us tonight. Amanda, Joseph, and I connected last week and found it extremely helpful. I felt like, I walked away from the conversation feeling much more confident in the choices that I decide to make for my own personal self. And I'm hopeful that, with education and information, you'll feel the same. So this is going to be an open conversation with Joseph so he can educate us all on COVID. But Joseph, why don't you just start and tell us a little bit about yourself? Those that joined earlier got to meet his adorable 14-month-old daughter, Eleanor, who is like the star of the show aside from you, but she's just adorable. And they attend our Hamden location in Connecticut, correct?
Yeah, well, I guess to start off here, I would like to thank you all for inviting me to come speak with you. It really is an honor, and being able to chat with the folks that are doing the absolutely imperative, crucial work like you all are right now, taking care of our kids and teaching them and fostering their learning. It is such important work, and being able to chat with you all about questions you may have regarding COVID or the COVID vaccine is really something I'm very happy to do. So yeah, a little bit about myself. So we've been in Hamden, Connecticut now for almost 2 years. We moved out here. My partner and I are originally from Nebraska. And we've kind of bounced around the country. I received my PhD at Colorado State University in Fort Collins. Studying mosquito-transmitted viruses actually is where I got my start. I then moved on to work at Washington University in St. Louis, the School of Medicine there, on some global health projects. So a lot of my work is in virology and global health interventions more broadly. And I came to the Yale School of Public Health, in April of 2019 to do work on what we call genomic epidemiology. So really trying to understand how viruses move through populations by studying their genes and their genomes. So how this can relate to COVID and how you all may be more familiar with that is hearing things in the news like these variants that are rising. So that's what our group is really focused on right now is taking viruses and sequencing them, trying to identify these variants of concern. The folks from Connecticut will know that Governor Lamont talked about this a few weeks ago. All that data actually came out of our lab. So we've been kind of on the COVID work for, the last year now. But yeah, that's how I got to Yale and how my partner and I ended up enrolling Eleanor in Building Blocks here in Hamden.
Great. Well, we are happy to have you as part of our family. And again, thank you again for taking the time this evening. I think, we had asked all of our educators to submit questions in advance so we could be most prepared for you and make best use of time. And I think by far one of the most asked questions was, how did this vaccine get developed so quickly, right? Were there shortcuts taken? Is it safe to take because it was developed so quickly? And, last week when we spoke, you really methodically laid out how the vaccine came about, and it made perfect sense. So if you could just talk through some of the 4 steps on how we arrived at where we are today.
Yeah, absolutely. And before I guess I get into like some of the more specifics of that, I think it's worth, for all of us, to take a bit of a step back and kind of reflect on where everything is and how we've gotten here, and how serious COVID is. We've lost nearly 500,000 fellow Americans to COVID since it started. Millions have been infected. Millions more around the world have died. This is by far the most devastating or disruptive pandemic that we've seen in my lifetime, anyways. It's an incredibly serious problem that, as a public health professional, this was always kind of worst case scenario, imagining something like this. We hope to never see something like we are currently seeing now. So kind of taking a step back and realizing it's affected our lives in so many different ways, and everyone's been affected by it, whether it's at work, whether it's your family, your friends. And it's hard to really kind of imagine how we got here. And the reason why I'm so excited to talk to you all about the vaccines today is because I can relay the excitement that my colleagues and other public health professionals and medical professionals also have about this vaccine, because the vaccine is not the only way we are going to get out of this nothing short of a disaster that we find ourselves in right now, but it is a very big important tool in the toolkit. So vaccines alone aren't going to do it, but it's the biggest bright spot that we've seen. So the question of the vaccine, how was it developed, how did we get here, is obviously something that's kind of on the front of everybody's mind right now. So yeah, the where we're at right now is I believe there's been 4 vaccines that have been given FDA emergency use authorization, is what it's called. Where the Food and Drug Administration has said that they have met all of the requirements that we have laid out for safety and efficacy of this vaccine, to the point where we are going to allow it to move forward in this country. The 2 most popular ones that people have heard of are the Moderna vaccine or the Pfizer BioNTech vaccine. I actually just got my 2nd dose of the Pfizer vaccine this morning. I'm so happy about it, and I feel so privileged and honored to have gotten it. And so there's lots of like particular questions about side effects and things along those lines, and I can give you some personal experience with that later. But yeah, those are the 2 main vaccines. And the question is, we just found out about this virus last December for the first time. How did we get from last December to an approved vaccine in less than a year? And there's a few things to consider when we're thinking about that. One is, as I've mentioned, one of the big points is the urgency of the situation we found ourselves in. This pandemic is like none that we have seen before in our lifetimes. As I'm speaking to you all via Zoom, it has disrupted every facet of our lives. So the urgency was there, and the urgency was realized very early on. I believe most folks here are in the Northeast right now. New York was hit the hardest. It was right in our backyard, and we could see immediately how bad this could potentially get.
In fact, our CEO is joining us as well, and he's based in New York. So literally all of the most hit regions are on this call between New York, Massachusetts, everywhere else across New England, obviously Connecticut.
And it really hit hard here first. So the urgency was realized early. So that's one of the reasons why we could do this so quickly, is because it is such an important problem that needed to be dealt with, and the vaccine was one of the best ways we could deal with it. The next thing is, I guess the typical reasons why vaccines can take longer from inception and development in through final approval is one, it costs a lot of money to run through clinical trials, and there's a lot of bureaucracy involved in developing any sort of medical procedure, whether it be a drug or a vaccine. You have to go through a lot of different steps. And the way I described previously is every single one of those steps, the preclinical trial, phase 1, phase 2, phase 3, all of that happened with the Moderna vaccine, happened with the Pfizer vaccine, happened with the Johnson & Johnson vaccine. It all happened exactly how we would expect it to if we were not in a pandemic and the urgency was not there. But the two things that can make that go faster is the incredible amount of resources that were thrown behind it. For a figure of speech, we threw the kitchen sink at the vaccine, billions of dollars coming from not just the US government, from private investors, also from governments from around the world. And importantly, there's a lot of bureaucracy and a lot of, hurrying up and waiting typically in trials to get to this point. And effectively, there was a global alignment that came in and said, we have two questions that we need to answer with this, and we are going to remove all of the other red tape just so we can focus on these two questions. And that question is it safe and is it effective? So all of these resources went in, a global alignment of these resources went in to answer those questions immediately. Another thing to consider is we were not starting from scratch here. There's decades of biomedical research that has gone into vaccine platform development, what's the most efficacious way to develop a vaccine, the best way to deliver a vaccine. This was not, we weren't starting from scratch. You can kind of swap out, different viruses or bacteria, whatever we're trying to vaccinate with. So there's decades of research led up to Johnson & Johnson developing this vaccine, or Moderna or Pfizer developing this vaccine. So we kind of had a head start there in that sense. And then finally, ultimately, the reason that you can actually get through some of these trials sooner in this specific scenario is because there's a lot of transmission that's occurring. We've had, every day since March, we've had at least 10,000 cases of COVID in this country. And what we've been experiencing the last few months, it's ramped up substantially from there to the points where hundreds of thousands of cases were occurring a day. And oftentimes in these clinical trials, the endpoints in a group that gets the vaccine versus a group that gets the placebo is measuring how many cases occurred in the vaccinated group versus the placebo group. And when there's a lot of transmission, it's easier to get to those endpoints. And what we saw in the Moderna and the Pfizer clinical trials, for example, was those endpoints in the placebo group were hit relatively quickly because there was so much transmission. And I was thinking of how I can give an analogy here that might resonate with folks. And because we're in the Northeast right now, folks can remember equine encephalitis two summers ago, I believe. Not last summer, but the summer before that was really, there was more cases than you would expect in Connecticut and Massachusetts and kind of up the eastern seaboard. A mosquito-borne virus that I'm used to studying. But there was like 20 total cases, I believe, that summer. And compare that to SARS-CoV-2, where there's been tens of thousands of cases in these states. So if you're trying to develop a vaccine for Eastern equine encephalitis virus, to have enough participants to see if the vaccine is actually working in people that got the vaccine versus people that got the placebo, it would take years to get to that point. But in SARS-CoV-2, it took months to get to that final end measure. So, I guess really to bring it all back together is we find ourselves in an incredibly urgent situation. The global community invested the resources, got rid of some of the unnecessary, bureaucratic measures that can potentially slow some of these things down normally. We were relying on technology that's been developed over the last few decades to come up with things like mRNA vaccine delivery systems. And then finally, there's enough transmission occurring in the area that you could hit these benchmarks quickly. And then ultimately, what it resulted in, for at least the Pfizer and Moderna vaccines, which are the only ones being distributed in the US right now, it resulted in two incredibly efficacious vaccines. My jaw literally dropped.
I'm sorry, you said efficacious fact?
Efficacious, yeah.
What does that mean?
So that's more of a specific term, I guess, would be like the measured endpoint. You see these numbers like 95% efficacious, and really what they're saying is based off the clinical trial data, that people are 95% protected from infection, and the efficacious data versus effectiveness, we're kind of splitting hairs, but the best way to say is it works remarkably well. Better than any of us in the public health community were hoping for. I remember being at conferences and people having conversations saying, if the vaccine can just prevent half the infections, 50%, we'll be happy with that. We can make that work. That was kind of the low benchmark. So when we saw 95% for two separate vaccines, I woke up and my jaw hit the floor. I was like, that was the best case scenario. Far and away.
A good day in this crazy time.
It was the absolute brightest spot that we had seen since March, far and away. And it's important to think about what that means as well. And I'm sure there might be some questions about this. I'm happy to go into it further, but that is 95% efficacious at preventing any symptomatic illness, regardless of how severe that disease is, which is very high. But for all the vaccines so far, including the Johnson & Johnson vaccine, the Novavax vaccine, the AstraZeneca Oxford vaccine, they have been shown to prevent 100% of deaths. No one that has received a vaccine in the clinical trials has died of COVID. So you can imagine that 95% efficacious against any illness is great, but if you get a cold because you got the vaccine and then you got infected with COVID, that's okay because it's not resulting in severe disease, it's not resulting in hospitalizations, and it's not resulting in death. So I cannot contain my excitement about it. These are numbers that gave me hope for the first time in quite some time.
So one of the questions that came in as you were talking about this specifically is there a difference between the vaccines that people should be aware of? And what I heard you say is that the real goal of the vaccine is to prevent death and severe illness. Mm-hmm. And so do all of the vaccines, what we know today, prevent death and severe illness?
That's exactly right. So there's differences in the vaccines. They're developed by different companies. Some of them take fundamentally different approaches to making the vaccine. But as far as what we know today from people enrolled in the clinical trials for all of them, they were 100%. They received the vaccine in the clinical trial. It was 100% effective against preventing death, and also well into the 90s at preventing severe disease that would be measured by like hospitalizations. And so looking out, kind of into the future, and I'm not in the prediction making business, especially with COVID. What's this look like? A year from now, 2 years from now, 5 years from now, all I know is that if we can prevent people from getting very sick and dying from this, we will be in a much better place than we are now. And the vaccines, I think, have shown that clearly at this point, that they will be great at preventing, people from getting really sick and ultimately people from dying.
And did you choose specifically Pfizer over Moderna? And was there a reason, or were you given a choice?
Great question. I was not given a choice, and from my understanding, most people will not be given a choice. It's kind of what is available at the time. I got mine at Yale Health because that's, and I should say the reason I was so fortunate enough to receive the vaccine is because I work with clinical samples and we grow the virus up, and that can potentially be infectious. And they were distributing Pfizer vaccines. I've heard that they also have Moderna vaccines, and it kind of, I would imagine, depends on when you come. I don't think there's especially between those two, a reason to choose. The Johnson & Johnson vaccine, which is does not have approval yet, but likely will shortly, is a single dose vaccine, which is, you can imagine why that's beneficial for all sorts of reasons, as well as thinking about vaccinating folks outside of the US, potentially like some lower resource areas. It'll be a really important one to put on. But my advice here would be, when you are eligible to receive the vaccine, if you choose to receive the vaccine, it does not matter which one you get, it's going to work well for you from a personal standpoint, but then also, the population standpoint.
Joseph, can you talk a little bit about the makeup of the vaccine? It's an mRNA mRNA vaccine, and that, it's not putting the virus into your body. Can you explain a little bit about that?
Yeah, happy to. That's correct. So it is a what's called an mRNA vaccine, which is a messenger RNA vaccine. And the way to think about this, so messenger RNA is made by your body all the time. It's a part of the DNA to RNA to protein, kind of the dogma of biology. It's RNA is just instructions for your cells to say, here, make this. Here's the sequence, make this protein. And what the mRNA in the Moderna and Pfizer vaccine is ultimately doing is delivering this to the parts of your cells that say, can you take this RNA, make it into the protein? It specifically makes the spike protein of SARS-CoV-2, only one of the proteins. There's dozens of them in the virus, so it is not a virus. It is a single one tiny piece of the virus. Just happens to be the piece that your immune system recognizes, and it's the piece that you'll make antibodies to, and different immune cells will recognize. That ultimately, it's like giving your immune system instructions to say, hey, if you see this protein again, get rid of it. We don't want it. It's not us. And that's kind of a quick way to describe how that specific vaccine works. Not all of them are mRNA vaccines. The two that are approved in the US right now are. There's some other ones that are more traditional vaccines that are also protein vaccines, so not like live virus vaccines by any means.
Okay, great. And I think there's been a lot of concern about the ingredients in, what the vaccine is made of and how your body is going to react, and the side effects or long-term effects of the vaccine. So can you talk about, the clinical trials that have happened, what we know today? Obviously, there's a lot that we don't know based on the vaccine, but, from the individuals that have been vaccinated, what are the level of side effects that they've had? Yes.
Yeah, you're hitting on a really important point here, and I guess I would like to make this point more broadly, kind of about public health and public health communication. I think it's so crucial for folks in my position working in public health to communicate what we know, but also importantly what we are still learning. We can't claim to know that we know how this is all going to play out. What we do know is this vaccine is incredibly safe and incredibly efficacious. We've done the trials, we've hit those numbers. As I was mentioning to you two in our previous call, that you can make the argument, and I think, this is a well regarded statement. The vaccines are the most closely monitored. If you consider them like a medical intervention, if you group them in with medical interventions or drugs you might take for something, they are far and away the most monitored medical procedure, I guess. That's how you like to refer to it as. We are constantly monitoring their safety. We're constantly monitoring their efficacy, and not just for SARS-CoV-2. Eleanor just went in today to her primary care physician not too long ago and got her yearly vaccines. These systems are in place, and they've been in place for a very, very long time. We've been using vaccines. They're far and away the best public health tool that we have to prevent illness from all sorts of different infectious diseases. And we've set up these systems for a long time that we've taken advantage of during COVID to make sure we can say with absolute certainty that these are remarkably safe things to a shot to put in your body. So that's not to say that there won't be side effects. I can tell you from personal experience, after the first shot, my left arm was very sore. Soreness at the injection site is the most commonly reported side effect. It's funny comparing to other vaccines that I've gotten. This one isn't as bad. I've had to get a variety of different vaccines for some of the work that I've done, especially overseas, and some of them have hurt much more than this one. But also what is very commonly reported, and I'm kind of waiting for this to happen to me probably tomorrow, is some headache, a little bit of fatigue, kind of just feeling achy in general. And that's something that I think folks should expect when they receive the vaccine. It's quite common in people that have reported that. But it's also a good sign that, the vaccine's working. That is, the feeling of maybe the slight fever, the headache, the achiness that you might feel is actually your immune response kicking in. It's
like
doing
morning sickness when you're pregnant, right? It means like actually your body's like adjusting to having this alien in you, and it's like doing the things it's supposed to do. Not that babies are aliens, but sometimes they are. There were 3 questions that came in that kind of talk to what you're talking about now. So I want to ask them, and then Lindsay, we can go back to the pre-submitted questions. One of the first was that one of our leaders had read that the Moderna vaccine is effective against the new variants. And given, Joseph, that you actually study variants of COVID, I wonder if you could speak to that. And is there a difference of vaccine in the variants, and or should we be worried about variants and vaccines?
Yeah, so that is kind of my bread and butter. That's definitely up like what my day job is. So yeah, there's all sorts of these quote unquote variants of concern. They're just slight changes in the SARS-CoV-2 genome. And there's been some that were first described in South Africa that look to show that they can affect vaccine efficacy slightly.
And just SARS-CoV-2 is what we would call COVID.
Yeah, so I guess to take a step back here, there's one virus, it's kind of a semantics thing, whether it's a variant or a mutant or how it's being referred
Teenage Mutant Ninja Turtle.
It is a single virus. It's SARS-CoV-2 causes COVID. COVID-19 is the disease. SARS-CoV-2 is the virus. It stands for Severe Acute Respiratory Syndrome Coronavirus 2.
So many names.
Yeah, it is a bunch of abbreviations, and it's one thing, but it's an RNA virus, so it uses RNA as its genetic material opposed to DNA, say, as humans use as our genetic material. And RNA viruses, they mutate, they acquire mutations that is not unexpected at all. So seeing these variants or these strains of this virus is not surprising. Now, seeing if some of those mutations might actually change the biology a little bit is definitely something that we're really interested in monitoring ourselves. And one of those, for example, is to see, is the vaccine still going to be effective? So, broad statement, yes, they absolutely are still effective against any of the variants that we've seen so far. The efficacy of preventing any illness might be dropping a little tiny bit in one of these variants of concerns first identified in South Africa. We haven't really seen it in the US. But importantly, in the data that we do have from that, the things that I think are the most imperative points about the virus to drive home are it is still very good at preventing severe disease and 100% effective against death. It's people are still not getting, really sick, which is the big goal here. So, that's going to be that this again kind of falls into the bucket of what are we still learning about this? How variants and the SARS-CoV-2 genome, how the virus mutations that are going to inevitably occur as transmission is still occurring, how is that going to slightly change the vaccine? And I think there's 2 important things here. One, viruses can't mutate if they aren't transmitted. So if we continue doing all these things that we know work, like wearing masks, like keeping our distance and trying to limit time indoors and improve ventilation, viruses won't get the opportunity to mutate because they won't be transmitted. And the other important point about this is these vaccine platforms are really adaptable. We can make a new vaccine to the variant first described in South Africa. Well, they are already. Moderna is making this as a potential booster. And it's just a matter of kind of swapping out one bit for another bit, and you don't have to. It's not starting the process from scratch. So I don't think it's something we need to keep an eye on and something we need to take seriously. But I don't think we're going to find something that will subvert the vaccines, for example.
So you mentioned South Africa, and the other question was then, so once we're vaccinated, once an individual is vaccinated, is it safe to travel? That's
a great question. And I think there's a lot of things to consider. with that. So for example, your own, personal risks, and the ability to travel. I guess my answer to that is it depends. Once you're vaccinated, what the data has shown is that your likelihood of developing illness is really, really low at that point. But one thing, again, falling into the bucket of what we're still learning, there's pretty good evidence at this point now that the vaccine prevents you from just getting infected in general. But that's not 100%. So there's still a possibility if you get vaccinated, you can actually get infected with the virus, meaning you can potentially still transmit the virus, although you yourself will not get sick. So we have to consider people around you in those situations as well. Now, once a bunch of people are vaccinated, and the majority of people are vaccinated, I think travel will start to pick up again. That's kind of the getting back to normal. So it's you have to think about it from a personal risk standpoint, but then also the off chance if you do receive the vaccine and you're exposed to the virus and you potentially still get it, but you're not going to get, very likely not going to get sick from it, you could potentially still transmit it to someone that's unvaccinated.
And the last question it's
So
not, don't worry, it's not the last question, just the last live follow-up, and I'll flip it back to Lindsay to go to more, is do you think that it will most likely be that this will be a situation that the COVID shot will become like the flu shot, and every year we're getting a new vaccine because this thing isn't going away?
That's a really great question. Again, I am not in the prediction business here. What I will say is I don't think there's just going to be a moment where we snap our fingers and say, yep, it's over. I think this is going to be a slow burn. I would imagine getting boosters for this virus is definitely potentially the thing that will happen. I'm not going to put a probability on that. But if you were to tell me a year from now that people have to go in to get the next round of the COVID vaccine to make sure that we're maintaining that immunity, that's another thing too that we're still learning about this is how long does, once I get the shot, how long am I protected against infection? Right. And the only way we can find that out is to continue doing these these trials, continue monitoring these things, and time will tell there.
So maybe.
I would say it's definitely a possibility. I would not be surprised if a year from now that you have to go in and get another COVID-19 vaccine.
Okay. How long? Yeah, I'm pressing mute.
Well, and I just to back up, because I know this has been one of the other questions is, and it falls into the bucket of that we just don't know for sure, but on the media, and we've been seeing articles around the fact that, if you are fully vaccinated, it's protecting yourself, but it may protect you from transmitting to other people. That falls under, we just don't know enough at this time, correct?
And we're learning a lot about that right now. And I can assure you that those studies are taking place, and there's a lot of ways to do them, and those are happening. I think some of the more recent data suggesting that it's, I hope that concept makes sense, that a vaccine can protect you against illness, but it might not protect you against infection. But I think a lot of the data is showing right now that it protects against both of those things, but likely not at 100%. It's hard to do anything with 100% certainty, right? There's going to be a fair amount of variability here. And that kind of leads me to, what I feel like I've been just saying for the last year now is we need to err on the side of caution. It's always best to err on the side of caution. So, after you get your vaccine, it's going to allow you and your loved ones to start interacting in a more normal way. And that's what part of the reason why I'm so excited about this. We haven't seen our family in almost a year. My parents have met my daughter once, and like that pains me. And getting a vaccine is like the route to making us be able to be reunited. But exactly what that looks like, I think we're still going to keep learning, and there will be guidance put out about it. But when in doubt, err on the side of caution. Continue to wear masks. Continue social distancing, even after you're vaccinated.
Speaking of erring on caution, can you talk about vaccines and food allergies? It is are those, there have been some reports about very few, but some reports about allergic reactions. Are those the same as food allergies? Are they different? And how do people get guidance around that?
Yeah, so I'll tackle that last part first. Best thing about things like, if I have allergies, do I need to get the vaccine? Great thing to talk to your physician about. I'm not sure if I've said this yet. I am not a medical doctor, and anytime that there is questions, I 100% encourage you to talk to your primary care physician about the clinical side of these things. So yeah, there has been a few examples of people having a severe allergic reaction, although they are exceedingly rare. I looked right before this this talk that it's about 10 per million shots of people going into a severe allergic reaction. But fortunately, that is all treatable. So some folks may have gotten their first dose already, and Lindsay, I know you have. You were likely asked to stick around after you got your shot for up to 15 minutes, and that is exactly for that reason. So at all COVID vaccination sites, there has to be medical staff on present there as well, the nurses that are distributing the shots, but there's also people with epinephrine or EpiPens, just in case that this exceedingly rare event does happen. It's very easy to deal with, and if it does happen, it would happen again within the first 10 to 15 minutes after receiving the shot. So again, exceedingly rare, but there are protocols in place to deal with it if it were to happen. And it's specifically about food allergies. I saw this mention of someone asking about like the egg allergies for, say, flu shots. That wouldn't apply here. The way flu shots are the flu vaccine is made is fundamentally different than the SARS-CoV-2 vaccine. So if you do have an egg allergy, so for example, if I had an egg allergy, I would absolutely ask my physician before going to get the COVID vaccine. But that isn't as much of a concern with the COVID vaccines that we have right now.
Great. And this may defer to, your local primary care doctor, but what is the impact or effect on, pregnant women and or mothers that are still breastfeeding?
Great question, and you're exactly right. My answer to that is, if you were pregnant or if you were still breastfeeding, talk to your OB, talk to the doctors that you've been seeing, and they will help you think through this. So the reason we don't have great data on this is pregnant women were not included in the early clinical trials, and that's common. Very often in clinical trials, developing something new, pregnant women and children are excluded for a variety of different reasons. I believe that don't quote me on this, but I'm almost positive that there are trials occurring now with pregnant women, because I know there are pregnant women that are choosing to get the COVID vaccine. I actually happen to know a few that have. They're reading what physicians and OBs have written about this. They think that pregnant women are at no higher risk of a severe adverse event getting the COVID vaccine than anyone else in the population. There is evidence, however, to suggest that pregnant women are at higher risk of developing severe disease from COVID. So this kind of goes back to the risk of getting a vaccine versus the risk of getting the virus, and the risk of getting the virus and detrimental effects from that is exponentially higher than any risk associated with the vaccine. And as far as breastfeeding moms go, again, as far as whether or not if you're breastfeeding, do you choose to get the vaccine? That's a conversation you need to have with your OB. But I did see someone asking about potential antibody transfers, which happens often. That's actually one of the beauties of breastfeeding is the passive transfer of maternal antibodies to your baby. I'm sure that's been studied, and that's a hard study to do. Knowing what I know about this, I don't see any reason why that wouldn't occur, that there would be a passive transfer of antibodies, not anything to do with the vaccine, the antibodies that you make yourself to it. But I would imagine that we will have better recommendations about that in the coming weeks and months. And in the meantime, and even once we do have recommendations, definitely chat with your OB and with your physician.
Great. And on that same topic, similar to, individuals that are looking to start a family, there's been talk about, people becoming sterile or having difficulty with infertility.
Sure. Yeah. So I've seen that as well. That I can come out and full stop say that there's no evidence to suggest that that would occur. There appear I was kind of interested because I'd seen that crop up, in my circles as well, and there appears to be linked to a study that suggested that a protein that women have could be somewhat similar to the protein that you're making the vaccine, that you're making antibodies to, and frankly, it's just not true. It's just bad data, and I can understand the concern there. I see that in the headline too. That's alarming to me. That we're planning on having more kids. That's not what I would want to see. But again, there's no evidence to suggest that. There's no data to suggest that, and the mechanism's not there. I don't unfortunately really have a whole lot more to say about it.
A lot more babies born from COVID. Well, we're all waiting for that baby boom, right?
Yeah,
of COVID. So we're starting to see it now. There's gonna be a lot of babies born, which is great for our industry. Okay, great. That is good to know. The other question was, and that just came up today, was the thought that if you're fully vaccinated, that if you are exposed to it, the CDC just put out a recent recommendation as soon as today that if you are exposed to COVID and you are fully vaccinated, that you don't need to quarantine, which in our world would be a wonderful thing. But what's the truth and how safe is that? Do we still need to be operating at the highest level, to reduce the amount of transmission?
Yeah, absolutely. So, I kind of yield to that, the CDC guidelines and local and state public health guidelines. So to me, what that would suggest is they have, data to suggest that if you are exposed and you actually potentially get infected, your ability to transmit it to someone else is also remarkably low, which is really encouraging. Like that's really, really good news. So them coming out with that recommendation, I think that's kind of what that's pointing to. So my default is that the CDC is recommending it. I would suggest that we can follow that. But I agree. You can also, from a personal standpoint, err on the side of caution. I'll just tell you, thinking about if I were to find myself in that situation, say I was going to visit my my grandpa who's in a long-term care facility. If I knew that I had been exposed to the virus 3 days before that, I wouldn't go visit them. So that's kind of a judgment call, I think. Again, I think that data is really encouraging. It's showing that the vaccines are great at reducing illness, but also reducing transmission. But personally, yeah, I would think about the context in which my next interactions would occur.
Speaking of context and making a personal decision, do you have a personal feeling about they said the Johnson & Johnson vaccine, that's just the one shot, which obviously seems more convenient, but I think the efficacy is 65% versus like 92. I might be screwing those numbers up, but is there a difference? Would you think that there's a difference of effectiveness, and would convenience win out?
Yeah, I think what you're getting at is that there's multiple things to consider there, and really, again, like the situation. So I guess I should say, flat out, if you are eligible to receive a vaccine, receive that vaccine. If it's the Johnson & Johnson one, great. If it's the Moderna one, great. And it's important, again, when thinking about the data specifically from the Johnson & Johnson trials, is the efficacy at preventing severe disease, meaning like you get really sick, and death is about the same. Which to me, that's the most important point of all of this.
You get a runny nose and a headache, and you have COVID, but you don't go to the hospital or send anyone else there, or worse.
From a population standpoint, which is often what we're thinking about as public health people, that's great. That's the goal here. But yeah, the one shot is nice. And also thinking about, convenience in being able to get the vaccine to like harder to reach populations, the Johnson & Johnson one will be crucial for that. Part of the problem with distributing the Moderna and the Pfizer vaccines is they require like ultra low temperature storage because it's RNA, and RNA is fragile. So it's not as easy to get to places that don't have the infrastructure to have it. So the Johnson & Johnson vaccine will be crucial in filling those gaps.
Speaking of it being fragile, can they be refrigerated? So, at these vaccine centers, you see that like there's many people looking for leftover vaccine doses, and what is the urgency of them having to use those doses versus if that's even possible? Can it be refrigerated like once it's been taken out? What's the process of why some vaccines are being wasted or thrown away?
Yeah, so as far as like the specific temperatures in maintaining what's called a cold chain from the time it is made at the facilities at Pfizer to the time it gets in someone's arm, so they get stored at -80, which is like this again ultra low cold temperature. But once they're thawed, I don't have a ton of familiarity with like what's that timeline look like. Can it sit in the fridge for 2 hours? I genuinely do not know. And that's part of the reason why some of these more traditional vaccine platforms that don't require that, for example, the Johnson & Johnson vaccine, are going to be really, really important.
Great. We just had a question come in about what would be the chance that the COVID vaccine and the flu vaccine would be combined for a one-shot combined shot.
That'd be awesome. Yeah, that'd be great.
Well, the nice thing is that the COVID vaccine is more effective than the flu vaccine, right?
It is, and so actually the flu vaccine it's not just like one thing. There's multiple what's called like different genotypes of flu. So yeah, the flu vaccine is it's made in a completely different way, and the efficacy is often much lower than what we're seeing with the vaccine, the SARS-CoV-2, and that actually has a lot to do with the biology of these viruses. Influenza virus is actually quite different than coronaviruses. Unfortunately, I don't know if fortunately is the right word here, but coronaviruses are easier to vaccinate against for a variety of reasons, which is good for like long-term prospects here.
Well, we'll take that considering we're in a pandemic.
It's a win.
So, yeah.
And going back to timing, another question that had just come in is that with the Moderna and Pfizer vaccines that are the 2 times, what happens if you miss your second dose? Are you at risk of something?
Great question. So there was some talk kind of earlier on about extending that time from getting your second shot. So I believe right now Pfizer's 3 weeks and Moderna's a month. I might have those 2 switched. But there is guidance out and evidence to suggest that can be up to like 40 some days. So if I were chatting with someone listening right now and they say like, oh, I got my Pfizer vaccine, but then 3 weeks later I said something I could not make that appointment, just couldn't do it, I would say that's fine. Try to get an appointment a week from now, and you'll likely still, in all likelihood, the exact same efficacy. You'll be just as protected as you would have if you got it, a week before that. But importantly, you need to make sure you still get the second shot. That booster, that second shot, is really why we're seeing this very high level of efficacy that we are seeing.
And can you speak to, because some people have said that the second shot is where they're seeing like, that you just got, so you haven't truly felt your side effects maybe as of yet, but why, you see much more side effects with the second shot versus the first shot?
Sure, yeah, absolutely. And that's, that appears to be like the norm at this point. It's very common that the second shot is where you're gonna experience, if you do experience some of these mild side effects, is when you're going to. And the way I've always thought about it is, the first shot, you're kind of priming your immune system, you're getting it ready to go. And then the second shot is you're showing it, right? You're saying, here's this protein again that we don't want, but your immune system at this point has been ramped up, ready to go. So it's kind of just like that exposure. And And again, the side effects that you are feeling are your immune response. The achiness and the headache, maybe the mild fever, that is your body fighting off what it perceives as an infection. Although it's not an infection, it's just, one little tiny piece of the virus. But because it saw it that second time is really when you're going to ramp up that very big immune response. And that's actually correlated again with why getting that booster shot is so important, because that's really when you're going to see, the larger antibody responses, the more reactive immune cells that you need to fight off the virus if you were to actually be exposed to it. So that those two things kind of go hand in hand.
Great. And I just have a question for myself as a mom of, 3 young kids. Where are we with, vaccinations with our children? Obviously being in this industry, we've seen cases rise in children. So it's not just adults, it's children that are contracting it as well. And, if
the kiddo whose mom did contract it, I'm super, and it was mild and he's okay. But I'm also super interested in when kiddos.
Yeah, I mean, what's the timeline for kids? If adults are fully vaccinated, is it less likely that children are going to contract it, or them passing along to other adults?
Yeah, great questions, and obviously something that folks in the crowd are thinking about, because you all take care of our kids all day.
Yes.
Right. Let me answer one thing that you mentioned first, and then I'll get to kind of where we're at with this. You said, would kids be less likely to get it once people start getting vaccinated? And absolutely. So like, as we start reaching towards this idea of herd immunity, the more people vaccinate in the population, the less likelihood transmission's occurring, which, just by chance, the less likelihood that a child would be exposed. So, getting vaccines in the arms of the early childhood educators here will ultimately make it safer for kids, which not only make it safer for yourself, it'll make it safer for the kids that you all take care of every day, which is like the best added bonus you could imagine. Yeah. But as far as vaccinating kids themselves, they're taking like a step down approach. So again, thinking about this initial data, and again, I hope that this is encouraging for you all to hear that our recommendations are completely driven by the data from the extensive clinical trials. So the reason that kids, and the same goes for pregnant women, haven't been eligible to receive the vaccine is because they were not included in the initial trials. So do we have any reason to expect that pregnant women shouldn't get the vaccine? No. Do we have any reason to expect that children shouldn't get the vaccine? No, but we just haven't, again, focused on those two things, the efficacy and the safety. We haven't done that trial yet, so we're not going to make those recommendations until we have the data. So what's happening now with children, I believe, so both Pfizer and Moderna have clinical trials in kids going on right now. I believe the ages 12 to 16 for both of them. So that's still not the kids that we're seeing at daycare, not that age, but it's just going to continue these trials effectively once they've demonstrated safe and efficacious in these teenagers. Then they'll start again going further and further down. And really, I'm as a parent, like the question of safety is always there. I'm a big advocate for routine vaccinations, and my daughter's fully vaccinated, but I had those questions for my physician as well. As someone that's in this field of public health and infectious diseases, I asked them these questions. What is the safety data? What are the likelihoods of severe adverse events? And fortunately, because they've been studying these for so long and have the systems in place that we have in place, they could answer my questions. And so with kids and COVID vaccines, we obviously the first things first, is it safe? But actually the efficacy might change. Kids' immune systems are kind of different than the adults' immune systems. So what might work great in us might work pretty good in kids. So we just have to obviously the safety data is crucial, and they haven't done those trials yet. But then seeing how well it actually works in kids will be, I think, the big thing.
In our last, we've got 6 minutes before we go. I want to make sure that we say thank you again, Joseph, to you for taking this extra time to be with nearly 100 early educators after you also have worked all day. We super appreciate it. And then Lindsay, I just also want to say thank you on behalf of the entire network of everybody, all directors and everybody we have working in Massachusetts and Connecticut and New Hampshire and Vermont, that like you reached out and made this possible, not just for the team in Connecticut, but for all of us in New England. It's a big, huge thank you. And I'm wondering, before we go, Joseph, if you could talk, this is more of a personal question, but why do you trust building blocks? And why do you trust center-based care during a pandemic?
Oh, yeah, absolutely. So we were looking for daycare options in, when my partner was about 6 months pregnant. So we came across building blocks, prior to the pandemic, and Eleanor had actually started just like 3 weeks before the lockdown happened. And then when building blocks opened back up, I had extensive conversations with Lori and Stephanie that run building blocks here in Hamden, and they were incredibly generous with their time and answered all of my questions. And as you can imagine, I had a lot of them. The safety protocols that you've all have implemented have gone above and beyond. I've never, I worry about my loved ones every day right now. We are in a very scary time. But dropping Eleanor off at daycare, I've always felt like she's been in incredibly safe and incredibly competent hands. Everyone I've come across at building blocks has been great. They do. I mean, Eleanor's beaming when she comes home. Like she clearly is enjoying herself so much. But yeah, from a COVID standpoint, everyone's always wearing masks, like I would expect them to. Folks are staying 6 feet apart, like I would expect them to. The rooms are kind of staying on their own, as I would expect them to. So I think you all are doing an incredible job of not only taking care of our kids, but also keeping our kids safe. And so much is asked of early childhood educators already, and teachers already, and we're asking them now to be epidemiologists and infection preventionists and all of this extra work on top of all the great work you all already do. So I mean, we are in a debt of gratitude to you all. It's remarkable that you all have been able to manage to keep kids coming and keep kids safe.
Thank you so much.
Thank you again, Joseph. And I think, if anything, if someone just walks away with one piece of information, the idea is information is power. So ultimately, everyone's going to make the best choice for themselves. But if we can educate as many people on the facts, I think that's what's most important, to get it from a person that studies this. This is their, your life. So we do certainly appreciate the time, and thank you from everyone from the home office, David, to all of our educators across the board for joining. I found it extremely helpful, and hopefully you all did too.
Yeah, as a reminder, we'll put out a piece of kind of what we learned tonight and what was shared, and a copy of this recording will also be available. And Joseph has also kindly said that he would share his email. So know that all of that is coming to you. Just give the marketing team like 24 hours and we'll turn it around.
Happy to keep having conversations and keep trying to answer questions.
I do have another question for you, and we
Sure.
I have a ton of questions because it's so fluid, as we all know. But what is your recommendation on, like, if a child is asymptomatic, right, but tests positive? Like, how far back are you recommend? I can't even speak now. It's past my,
bedtime for everybody.
Yeah,
let's be honest.
Recommendation on when to start quarantine. If they're asymptomatic, is it 2 days prior to symptom? If they were symptomatic, it's 2 days prior to symptoms starting. Or if they are asymptomatic, is it, quarantine starts from when they receive their positive test? We've heard conflicting results.
Sure. So quarantine would start day of positive test. So I believe it's 10 days right now is the recommendation for CDC. So if a child were to get tested, out of just a routine testing, and they test positive, 10 days from that point on,
Just flagging that for those that are still on. So we're going by local health department. So Connecticut has reduced it to 10 days, but many decisions are being made at the local level. So a lot of them are still doing the 14
Massachusetts and New Hampshire is 10 days.
Yeah.
So yeah,
Vermont,
abiding by,
if you know what it is, you can put it in comments. I forget. I'm usually good with it, but I forgot.
abiding by those guidelines, yeah, is crucial. But thinking about potential exposures, who that child may have exposed, you would go up to 2 days prior to start of symptoms. But if they don't ever develop symptoms, 2 days prior to the start, or 2 days prior to that positive test is when you would backtrack, do the contact tracing, and folks that saw the child the day before and had close contact for 15 minutes or whatever the specific recommendations are now, that would be considered an exposure, and that person should go into quarantine for whatever that length of period.
10 days in Vermont too. Thanks, Ilya.
Yeah.
All right, perfect. That's helpful because I think that there's so much, there's a lot of information floating around there, and certain health departments are giving varying or conflicting information.
Oh,
And educators are doing.
Lindsay, you made it to the whole end. So Lindsay flagged that her internet was being glitchy and it might get robotic. It just happened for the first time. We started on time. We're going to end on time out of respect of everybody's time. Thank you, thank you, thank you. And this is just the beginning conversations. Joseph, thank you so much. We really appreciate your time.
Thank you all for what you do. Honestly, it's so crucial. Honored to get the chance to talk to you all, and happy to keep these conversations going. It's the most important part of my job, in my opinion. So
Thanks.
Thank you again.
Lindsay. Bye, everybody.